So as a part of the fellowship, you take 3 trips. One is to the CDC. That's in the fall during training.
So I remember someone described the fellowship, especially the first few months, the fall when you're doing all the meetings, is kind of building your Rolodex in health policy. We visited CDC, so I felt like I had a better understanding of how the CDC worked, how the vaccine unit worked, how they thought about approvals. I've also stayed in touch with a lot of the people that we met.
On our time there, we were wondering, well, why are we here? Why do we fly out to Atlanta and spend nearly 3 days at the CDC? And at the end of the trip, you really come away from it having a greater appreciation for what public health is about. You hear from all the motivated people who are there, who love what they do, and clearly are not in it for the money. And it's essential because the CDC is a key piece of healthcare delivery in the United States that's just not here in DC. And so I think that trip is important because it allows us to see an essential part of that healthcare delivery apparatus, but really also meeting the people who you read about and talk about on the day-to-day, and learn their passions and what motivates them to do what they do and serve the country in that way.
We were staying in a hotel that had a swimming pool, but none of us brought bathing suits. It was October. It turned out it was warm. So one of my co-fellows and myself went to Target across the street to buy bathing suits. I was pregnant. She was not. But the only bathing suits, because it was October, at Target were these very flamboyant floral maternity bathing suits. So we both bought one and wore matching bathing suits in this pool while, hanging out, talking about life. So that was a fun memory.